Thank you all for joining today's webinar. And I welcome you all on behalf of IIHMR. So my name is Mukund Kulkarni. So I am working as the Director of Quality in Optum Healthcare. So I have around 20 plus years of experience. So my experience has been mainly in the healthcare IT field. So I work with companies like Philips, Allscripts, Streamline Healthcare with the different roles. So today I'm really excited to host this session along with our esteemed panelists, Mr. Himanshu Burad, Mr. Shaurya Verma, and Pankaj Rahi. So before we start today's session, I would request to all of you to see a quick video on IHMR campus and the facilities it provides. Can you please run the video? Thank you. Thanks for sharing the video. So let me start with introducing our esteemed panelists. So, so hope my screen is visible. One of our panelists is Mr. Himanshu, and Mr. Himanshu Burad is working as an officer on special duty for an additional CEO, Ayushman Bharat Digital Mission at National Health Authority in New Delhi. So, Mr. Himanshu Burad, prior to this, has worked in the COVID war room of the Union Health Ministry and also managed the oxygen concentrator MIS portal. Other assignments at the Union Health Ministry involved working on PM Ayushman Bharat Health Infrastructure Mission, as well as 15th Finance Commission Health Grants. So, welcome to the panel, Mr. Himanshu Burad. So our second panelist would be Mr. Mr. Shaurya Verma. So Shaurya Verma is basically the founder of MD Junior and IXA.ai. So IXA.ai is a AI native healthcare platform with a with a vision to bridge the health gap. Mr. Shaurya is also the founder of MD Junior. So MD Junior is basically a non-profit kind of a organization which oversees around 10,000 patients in 8 countries with a network of around 600 plus physicians and 5,000 plus medical student volunteers. So Mr. Shaurya comes with around 15 plus years of experience. He's a John Hopkins alumnus and is basically an impact-driven strategist and someone who would always help in empowering the next-gen healthcare leaders. He has worked at Markway Healthcare and pharma companies while he was working as a in consulting at McKinsey. He has also worked with the UN Development Program on the electronic vaccine intelligence. Sorry?
Yeah, the working on the panel.
Okay. In the electronic vaccine intelligence network, developing the initial models for forecasting supply chain demand. So his work has been really helpful. It has contributed to over 90 million vaccines being saved in several years, and it has laid the foundation for COVID. He is also a keynote speaker for TED and conference chair for global health conferences. And our final speaker would be panelist would be Dr. Pankaj Rahi. So Pankaj Rahi is the associate professor at IIHMRB. So he's a state awardee and COVID-19 warrior of Chandigarh administration, National Health Mission. And he has basically a state awardee awarded the state award from Honorable Governor and Administrator of Chandigarh. He has 16 plus years of experience in the domains of health IT and e-governance systems and 4 years of academic experience in the domains of AI and ML. He's worked on predictive healthcare modeling, smart e-health, blockchain, and telemedicine. So he has published 17 research articles in various international journals and also written a book titled as Handbook on Big Data Analytics and Machine Learning. He has published around 10 scientific utility patents and has been granted around 3 scientific design patents design patients, and he has been also granted 2 international scientific patents and 1 copyright of for ML-based concepts. So these are our 3 esteemed panelists today. So I'm really excited to be discussing with them on today's topic. To set the context for today, we have been hearing a lot about AI and DS, artificial intelligence and data science, in the last few months, or I would say the last few years. So it's growing in prominence day by day, and it's impacting various industries. And healthcare is one of the major industries, I would say, where it has been impacting. So today's topic would be on augmenting healthcare with AI and data science linked technologies. So without further ado, I would want to go and start with the questions. So just give me a minute. Yeah. So the first question would be to Mr. Himanshu. Sir, what are the steps the union government has taken on large-scale IT intervention in healthcare?
First of all, thank you so much, Mukund Kulkarni ji, Dr. Ahi, for inviting me to this webinar by HMR, and it has been a privilege to talk to the people present here and say and share the informations about the steps which have been taken by union government that is in this direction. So just to give you a broad overview, the government of India has started on this journey way back in 2017 with its national health policy, when it clearly demarcated the role of information technology in healthcare to plug in the universal health coverage gaps as well as the SDG 3 gaps. So since then, Government of India has been taking a series of steps to deliver healthcare in more efficient and accessible manner. To state some examples, I think one of the prominent example which everybody is aware and everybody has touched upon is the application which we worked on during the COVID war room days. CoWIN, while we have interacted with it in a personalized way, but I would like to share some statistics to highlight the scale with which it worked. So CoWIN has closely vaccinated around more than a billion people, and more than 2.2 billion doses have been given to the citizens of this country. Now, that is a very obvious part of it, but however, the scale with which CoWIN has worked is something which is mind-boggling. So, I'd like to share one particular day that was, I think, around on 17th of September 2021. India vaccinated around 2.5 crore vaccine doses in world in a single day. Now, considering the scale, this is more than population of 150 countries put together. So we have vaccinated entire countries in one day. That's the scale with which we are talking about the IT intervention which government of India has been doing. And to take it a further step further, another similar intervention which was launched during the same time COVID, which is the e-Sanjeevani. While we may not have interacted with e-Sanjeevani that much, but e-Sanjeevani as of now, it's a national telemedicine platform which is helping the last mile in the country to access quality healthcare at their doorstep. So they don't have to move to a city headquarter or urban center to avail the health services. They can simply do the telemedicine call free of cost at their comfort of homes. It is equivalent to government service of Practo and other bit, but telemedicine is largely meant for all the people of country. And to again to showcase the scale with which it is working right now, so far we have done 20 crore teleconsultations, and on a daily basis we are clogging around 4 lakh teleconsultations per day. That is the scale with which we are working in national telemedicine service. Again, to show the impact of this, so far uh, telemedicine has delivered the telemedicine services, teleconsultation services to over beneficiaries have been 57% have been women, 12% have been senior citizens. So it is tapping that untapped potential when it comes to the unmet healthcare needs of the country. So again, large scale active intervention by the government of India addressing the poor and the vulnerable sections of the society. So this is another step in the similar direction. The third, which I would like to highlight for the audience, is the Pradhan Mantri Jan Arogya Yojana, which is the PMJ scheme. It is the world's largest health assurance scheme, providing 5 lakh rupees health cover to 55 crore individuals. Again, 55 crore individuals is a humongous number when it comes to insurance across the countries, where the population of countries usually vary between 5 to 6 crores. We are providing insurance of 5 lakh to 55 crore people. Now, why I mention PMJ? Because PMJ is entirely cashless and a paperless scheme. The citizen do not have to carry any health record by themselves. They just have to walk into a hospital, authenticate themselves as PMJ beneficiary, and they can get the treatment and walk away from the hospital. Again, a large scale possibility is only visualized through the IT platform, which is housed by the National Health Authority, where I'm currently based out of. And National Health Authority is driving PMJ and another Ayushman Bharat mission, which is the Ayushman Bharat Digital Mission, which aims to establish the national digital health ecosystem. I'll touch upon national digital health ecosystem in some time again, but to highlight the scale of national digital health ecosystem under ABDM, we are trying to provide health ID to all the citizens of country, and so far we have been able to give ABHA, which is the Ayushman Bharat Health Account, meant for every citizen to 60 crore individuals. For that, the citizens will be able to maintain their longitudinal health record. Now, this is again a very unique feat which we are trying to do in country, where we are motivating people to maintain their longitudinal health history. And while we try to refer as that from birth to cradle, everything at a single place in your mobile phone. So that is another endeavor which the government of India is taking to utilizing the IT to deliver the health services. So yeah, broadly, there are many other aspects and initiatives which I'd like to touch upon, but these are the four prominent ones which government is doing, and the world is also taking notice of those. Thank you.
Thank you, Mr. Himanshu. I think the statistics and the figures which you provided in terms of vaccinations done in a single day, the telemedicine kind of outreach, and the insurance is just mind-boggling. So quite some great figures, I would say. Thanks for that information. My next question would be to Mr. Shaurya. So, Mr. Shaurya, you have been an entrepreneur, and you have, in fact, started 2 companies. So, as an entrepreneur, can you provide your insight into the changing healthcare IT landscape?
Absolutely. Thank you, Mr. Mukundan, for the introduction, and Dr. Pankaj for having us. And Himanshu, absolutely loved hearing the story. I mean, the Ayushman Bharat Digital Health Mission was, one of the main motivators for me moving to India. So I've spent a lot of my career in the US and done healthcare work in many places, but I think that it's really a pivotal moment in India to be building in healthcare in the technology industry. And before getting into some of the specifics that we'll continue to talk about here, I think for many of the people that are getting into this field, I'll just paint a little bit of a picture for where we are today. So imagine, let's rewind 50 years back and think we are sitting on Wall Street. You're on the trading floor, and there's hundreds of people that are, have a phone in one hand, have a piece of paper in the other hand, and they're haggling to buy and sell every single individual stock. In 1971, the first electronic stock exchange was introduced. And then after that came the first electronic trading platform and then online brokerages. By the 2000s, technology had basically transformed the way that not just how stocks were traded, but how decisions were made behind which stocks to trade. The algorithms were permeating every single millisecond of that entire financial value chain. Back then, 50 years ago, 100% of stock trades were made by humans. Today, 80% of those are algorithms. And that, I think, gives us an idea of what the revolution that can potentially happen in healthcare with AI, I believe. Everything from drug discovery, using AI to accelerate research into identifying novel therapeutics, to diagnosis, care delivery, to clinical workflows, the back office, care management. Every single step of this value chain is being reevaluated because of the new technologies that are coming out in the AI industry. And look forward to continue to discuss a little bit.
Thanks, Mr. Shaurya. I think the kind of this one which you gave, right, the timelines from the 1970s to till now, I think that was really helpful. I mean, it really shows the potential which information technology and AI have in store for us. Okay, so my next question would be to Dr. Pankaj Rahi. So, Doctor, what are your views on augmenting healthcare with AI and data science? And also, what are the possible benefits to ecosystem on adopting such technologies?
Yeah, good afternoon to all. And thank you for Mukund sir for a nice introduction. As Mr. Himanshu said, the augmenting healthcare with emerging technologies like artificial intelligence and data science give a manifold benefits to the patients, healthcare providers, and management. These technologies have the potential for creating more effective, efficient, and equitable healthcare system for everyone. Although AI algorithm has the ability to analyze vast amount of data for improving the diagnostic and identification of patterns or which are invisible to the human eyes, but a fantastic capabilities could be leveraged if we detect the disease pattern or some symptoms well in advance, till it is not spread among the community. So the enhancement of accuracy and efficiency being supported by the technology is highly appreciable in this technology era. Other than this, the data science also acknowledge more personalized approach to the healthcare by analyzing patient unique medical history and genetic makeups, which a doctor can tailor the treatment which is needed in the subsequent follow-ups for curtailing the disease. So AI offer a manifold benefits in terms of benefits to the patients, healthcare provider, and management. Even management can follow the previous or market trends and then can precisely customize their decisions so that which will be beneficial for the large public at maximum extent. Yeah, thank you.
Thanks for that detailed.
Coming to the second question regarding the potential benefit to the ecosystem, since you see the the technology like telemedicine, e-Sanjeevani platform, which is being highlighted by Mr. Himanshu, you see that how the technology is benefiting the last beneficiary at their doorstep. So it has a lot of potential, and it gave a very much benefits to the all, even to the healthcare provider and healthcare seekers also. Other than this, this offer multiple benefits in disease, disaster, risk reductions, and prevention activities. AI can analyze historical data, weather condition, weather patterns, which are equally contributing to any disease. So, I mean, this technology is fabulous and it will beneficial to every citizen or every individual at the globe.
Thanks, Dr. Pankaj. I think that was a very informative reply, and I'm sure, I mean, a lot of people who are listening to it will be benefited from that. So my next question would be to Mr. Himanshu. Mr. Himanshu, what are the challenges faced for rolling out these initiatives?
Again, thank you for this wonderful question, and I would like to pick up on what Shaurya and Dr. Rahi said in their initial remarks. While again, I think the benefits of this using AI and IT and ML as well is humongous in the field of healthcare, and particularly in India, where we have shortages of doctors, shortages of technicians. So I think AI can be a huge boon in each and every sector. But the challenge remains the same, that the source where the data is, because AI and ML, these all things run on the data. Unfortunately, in the health sector, we don't have that data generation at the source. By source, what I mean is the hospitals, the single doctor clinics, which write your records. What Dr. Rahi attributed to the longitudinal health record, which we are trying to do under Ayushman Bharat Digital Mission, and we are nudging the citizens to create their health history. As of now, there is some behavior change which is required in the citizenry to kind of maintain their health record in a digitized manner. Once that is digitized in nature, then subsequently we would want them to keep it in what do you say, machine readable format. Because till the time we don't have the data in machine readable format, mind you, the usage of AI will be limited in that nature. So therefore, the source, either it be the healthcare provider or the citizen, both have to be digitized and transacting in a digitized manner. Once they do these things, I think we will see a huge potential in I would say auxiliary services on healthcare. While the examples I attributed to are mostly on service delivery aspect, be it immunization, be it telemedicine, these are all giving in nature. What input it comes from the citizens by observing their health record, health history, what Dr. I perfectly mentioned, the precision care medicine is a beauty which we can only see if we have the health history of the citizen. And that is the challenge which we are facing right now. That citizen, I'm sure, I mean, many of the listeners on this webinar might not be maintaining their health record in a digitized manner. They would have been keeping it in a file format, lying in some almirah or in cupboard. But are they keeping those health records in a digitized manner so as to allow the AI and other technologies to run their intelligence on it and provide a very customized service to them? Many large language models are doing it, but I think still the potential is huge, and the challenge majorly, in my view, lies in the behavior change of doctors as well as citizens.
Thanks. Thanks a lot, Dr. Mr. Himanshu. I think the challenge which you told, right, in terms of making sure that the records are digitally maintained and the kind of effort which you are putting in the next few years, we can see quite some changes in the people's behavior, and hopefully it will help in rolling out other IT initiatives. My next question is to Mr. Shaurya. So, Mr. Shaurya, what do you see as the current AI scenario trend in healthcare?
Yeah, absolutely. And definitely just want to echo what Mr. Himanshu and Dr. Rai are saying about AI is data. Data is AI, and it doesn't work. We truly can't achieve the vision of AI without a really strong data foundation. And I think that truly is the largest challenge that we've been seeing as we've been building. And you see that whether you're in India, whether you're in the US, whether you're in any environment, because AI only works on the data. But I think that that's linked to this point that I have here, which is that healthcare AI is very much in its early days. The market, just to give you a quick industry perspective here, the market is dominated by two types of companies. There's tech-enabled services. These tech-enabled services companies have quick growth paths, but they have trouble with the long-term unit economics. And then there's healthcare SaaS, software as a service. And these have high margins, they're very tech-enabled, but they struggle with selling their technology to health systems because at the end of the day, healthcare is a human-to-human based thing. These sort of cloud-based screens, it doesn't work for this industry. It's not built for this industry because this industry is all about human-to-human interaction. So overall, if you look at any other industry, digitization has created, these amazing deep tech use cases that haven't really been realized in the clinical environment. When you think about really strong data science, when you think about precision medicine, you look at these algorithms that are powering the world of fintech, we can't achieve the same thing in the healthcare world because clinical workflows are based around human-to-human interaction. And I think that kind of is why healthcare has been the slowest industry. If you look at any vertical, healthcare has been the slowest industry to be quote unquote SaaSified. And it's because fundamentally the computer screen wasn't made for the medical environment. And I think that's what's exciting about this time, right? Because people aren't going to the hospital. They're going to a hospital not to get a medication. They're going because they want care. They have this anxiety that they feel like an illness is threatening their life, and they want to feel like a human is looking after their care, a doctor specifically. So I think that's kind of the balance that we're looking at here with AI is that there's now these really strong conversational AIs that are able to leverage technologies in the AI world that have been around for quite some time, around data science, and inject it into the healthcare ecosystem in a way that aligns it to the format that people want to see, that makes things feel more human and extending that human touch. And some of the challenges that it's solving here, for example, when you look at clinical documentation, which is a very specific use case that's kind of been pushed the farthest so far, in my opinion, in the AI world. In the US, their doctors, US is considered a very SaaS forward country in the healthcare environment, right? And there, doctors are spending on average 35% of their time on computers doing documentation. So that's 4.5 hours of their day is going to just logging in their electronic health records. And now comes in this a company like Nuance, which is, they run about 80% market share in the clinical documentation space. And they've built technology that basically just a hardware that sits in the room and it's always listening to every consultation, automatically scribing those notes so the doctor is able to focus on that human care. And their face is not in a computer screen. Their face is actually facing the patient and they're listening to the patient.
பாப்கார்ன் கடை வச்சிருக்காங்களா?
So I think that's one of the examples of the exciting things that are coming in healthcare, and I think that's why what we're seeing in the industry side is this new third category, as opposed to those two categories I said earlier. We're seeing this newer category called services as a software. Is how can you package and automate and use conversational AI to drive services as a software?
Thanks, Mr. Shaurya. I think some very valid points which you told in terms of the amount of time that doctors spend on documenting, and of course that's humongous, the amount of time currently which they're spending. And I'm sure some of the technologies like what Nuance has come up with, and of course maybe your company as well, will really help in reducing the doctor's time in documentation, and it will help them in providing the care to the patients. Thanks for that. So my next question is to Dr. Pankaj. Sir, how do you see the role of academics in adopting AI and data science to larger scale?
Yeah, thanks. It's a nice question. Academia plays a very vital role in leveraging any or introducing any new technology. The role of academia is very critical and important for improving the systems as well as the learning related to the new technology. Like the educational institutes can introduce the new curriculum related to the new emerging technology like artificial intelligence and data science. They can offer some short-term course to their existing manpowers, which they can go through and accordingly equip themselves for the new technology platform. Likewise, the IIHMR Bangalore has also started a new postgraduate program for their postgraduate students for artificial intelligence and data science in healthcare. It is a kind of new program we come up with the approval of AICT. It is a 2-year full-time program equipping the students with technical skill, knowledge of the industry and healthcare so that they can implement the technology to the larger extent and provide the better quality of care as well as leverage the technology to the individuals or the existing systems. Other than that, we are offering other courses related to the workforce, which the professional who are already working in the industries. There are many courses running in the IHMR, which is related to the executive course with the digital and connected healthcare, and a course related to the IoT and IOMT for transforming the healthcare, a digital connected hospitals are basically utilize such kind of courses. So academia plays a very vital role. Other than this, academia is bringing a new research or fundamental research or applied research where we can even see that which are the system which are most beneficial for the public and can be leveraged to the larger extent. So accordingly, they are conducting the research and coming up with the prototype, and even the IHMR also conducting a lot of technology driven research in the digital healthcare or healthcare IT and supporting the other hospital and the government in taking this forward. So that's
Yeah.
it from my side, sir.
Thanks, Dr. Pankaj. And it's great that it's not only for people who are freshers, but it is also we can tailor it even for people who are already working so that it will help them in getting knowledge on AI and data science, and it will help them in their career growth also. So thanks for that information. So moving on to the next question, it is to Mr. Himanshu. So Mr. Himanshu, what are the plans for ABDM to adopt AI in healthcare?
Right. Again, I'll repeat what I had earlier said, that the fundamental goal of ABDM is to establish the national digital health ecosystem. Now, under the national digital health ecosystem, the government is basically building a digital public infrastructure. By digital public infrastructure, they are building the digital railroads in the form of registries, which can act as a single source of truth for citizens, for healthcare professional, for healthcare facilities. We refer to them as ABHA, HPR, and HFR. So ABHA is for citizens, HPR is for all the professionals, and HFR is for all the health facilities. Now, the reason for identifying these individuals, these stakeholders with unique identifier is a simple one, because any transaction which takes place in a digital realm, one has to identify each and every stakeholder with a unique digital identity. That's what National Health Authority under Ayushman Bharat Digital Mission is doing. Now, on top of this, once you have identified the individuals with their unique identity, you need to enable certain gateways or protocols through which these stakeholders can talk to each other. Under the ABDM, under the National Health Stack, NHA is building three primary gateways. These are named as Unified Health Interface, which will enable interoperability in health services and discovery. The second gateway is HIECM, which we refer as Health Information Exchange and Consent Manager. It will enable interoperability in health data exchange with the consent of citizen. The third is the National Health Claims Exchange, which will enable the interoperability in health claims in the insurance payment ecosystem. Now, again, these are protocols. These are not platforms. There is a difference between the protocols and the platforms, because government is making these protocols so that any private sector can build solutions, which I think Shaurya also alluded to, the software as a service, multiple such solutions which cater to the private sector like you and me. They can come utilize this gateway and build their solutions on top and offer those services to the citizens or to the hospitals. To give a brief parallel, how does this look? So many of us would have used the vaccination booking slot during the COVID days either through phone pay or through telegram application or through paytm, any other application. No, this is a simple concept known as open apis in the digital public infrastructure realm, where any private sector application or entity can rely on government infrastructure. So government made the backend of the COVID vaccination module and then opened it for private sector to consumption. And that's how you and I could book slot on any platform. We were not bounded to the COVID platform or COVID website. That's the similar approach we are taking on Ayushman Bharat Digital Mission, where all these three gateways will be the digital public infrastructure, and the private sector can build a SaaS-based model or PaaS-based model on the top of these gateways, and then they can offer it to citizens. To give an example in this realm, for citizens like you and me, we would need a personal health record application, just like we need a UPI application to transfer the money from one provider to another. Similarly, in the health domain, you would need a personal health record application. Government has made one reference application known as ABHA, which is equivalent to the BHIM of financial world. But there can be n number of private sector applications in personal health record realm, which can offer services to you and me. And services are the same which Dr. Rahi and Shaurya both referred to in their initial remarks, be it precision care medicine, be it personal care medicine, be it maintaining longitudinal health record. All this is possible with the gateways and the registries which we are making under the digital health mission. On top of it, I think we would like to believe the limit is, I would say there is no limit onto the innovation which can be done on top of this, because once you have data in place, once you have registries in place, I think the sky is the only limit for private sector to unleash their animal spirits in the healthcare domain. And ultimate beneficiaries, in my view, would be us, people like you and me, who would be getting more and more health tech services, just like we are getting the fintech services these days. So that's the broad role which I think ABDM can play in digitizing the entire healthcare bit. Yeah.
Yeah. Thanks, Mr. Himanshu. The details you gave on the unique identifiers and also on the interoperability, so was really eye-opening. And I'm sure, I mean, I've been working in the US healthcare kind of projects. Even there, interoperability is one of the major puzzles, I would say, to solve. So yeah, I think that's a great information from you. So next question would be to Mr. Shaurya. So what is the future of AI in healthcare transformation?
Absolutely. It's a big question, and it's hard to put into words. So I thought I'd start with some numbers. When you just look at just looking at public healthcare enterprises, so just publicly listed healthcare companies, the potential operating improvements, as estimated by McKinsey, could create $5.6 trillion in value. That's not including improvements to government operations. That's not including pharmaceutical companies. That's not including private companies. That's not including digital health companies. I mean, the fundamental scope of what AI can do for the way that healthcare operates is enormous. So, let's just to talk through a couple of examples here. You can understand it from any of the perspectives of the healthcare industry. We call it the 5 Ps. There's the patient, the physician/provider, there is the pharma, there's the payer, and there's the pharmacy. And you can think about the use cases that AI kind of brings about within any of these. From the patient perspective, AI can improve access to screenings and diagnosis, and there's many companies and examples that are doing that are helping detect life-threatening illnesses earlier. From the provider perspective, there's AI that's being built to improve clinical decision making. So, there's these big language models that are super targeted at specifically analyzing millions and millions of health records so that it can understand how to make clinical decisions better. And imagine that, 20, 30 years down the line, when you have smart hardware devices that are also connected to these conversational agents and these AI agents, where you have IoT devices talking to, artificial intelligence, so that, say, the devices that a patient is hooked up to in the hospital, it's automatically detecting, when something goes wrong, the AI is automatically detecting what's going wrong and is able to flag that to a doctor where they're understaffed and undersupplied on nurses and resolve that issue much quicker. So, there's organizations that have been very early to that idea, like Cloud Physician building out the idea of an EICU. And I imagine, imagine that 20 years down the line when you truly have an intelligent ICU, It's also doing many things on the provider side that's creating operational efficiency, everything from documentation, payments, scheduling, billing, compliance, all of that is able to be automated with newer algorithms and these agents that you're able to inject into the value chain. From the pharma side, there's drug discovery. It is the really big one. It's truly novel. Is a company like AlphaFold, which is basically pushed forward. They say pushed forward drug research by 850 million years in the number of proteins it's been able to discover. And I mean, it's just to fathom the amount of the depth of which AI is able to go that our own research has not been able to in a short span of time. Even from the pharmacy side, AI is helping make drugs more accessible, but through algorithms that are improving the distribution. From the payer side, of course, insurance companies are able to improve their underwriting processes and get more preventive care to the patients that's improving the continuum of care. So not to continue to ramble here, but there's use cases across the value chain, and it's really the entire value chain for all the people that are listening in. It's your opportunity to rethink what the future of this industry is going to look like, because this technology is going to work alongside humans to reimagine what care is going to look like. And it's truly a green ocean. The opportunities are endless. And I think that's what really makes it an exciting time to build in this space.
Thanks, Mr. Shaurya. I think it was put very nicely. So the way you integrated all the 5 P's, right? The payers, providers, and the pharmacy, all the summit. I think it made a lot of knowledge. Thanks for that informative details you provided. So my next question would be to Dr. Pankaj. So, Doctor, how is IHMR helping with equipping the students to understand the latest trends in healthcare IT?
The educational institutes are basically devising various strategies to equipping their student with the latest trends of the technology. So here in IHMR, we are also trying to match up the learning skills with the industry requirements. So accordingly, we are conducting a regular review of the course, which is being undertaken in the concerned sessions for the students in consonance with the industry experts and industry requirement, and so that we are updating the course contents so that the student will be having an adequate knowledge and learning during the course contents. Other than this, we are having a dedicated center for advancing digital healthcare in-house in IIHMR Bangalore, where student can simulate various learning projects and get the acquaintance with the industry requirement and the live projects we are doing at our center. Other than this, we have a well-planned presence of industry expert and industry experts. We are roping in industry experts for delivering the adequate knowledge of the industry and as well as the industry requirement, so that all the students who are taking education here are getting exposed to the industrial expert and their knowledge as well as the requirement of the industry. Other than this, sir, we are having dedicated digital health and data AI lab, which focus on hands-on emerging technology like AI and data science related project. And with the help of this lab, student can develop their program with the help of machine learning, deep learning, and other image processing analytics, and accordingly perform the projects. So as a whole, we are offering another certificate course during their learning programs, and they can opt those learning courses besides as the routine curriculum of the course. So we give a kind of environment to all the students, where they can enhance their knowledge with the help of the academic expert available, some guest faculties being available at the IHMR, even in sync with the government initiatives. Like you can see today, we have a OSD from the government of side with us. So accordingly, we are keep roping in the professionals, and professionals are happily linking with us for delivering the same. the technology interventions for large scale as well as the student learning platforms.
Thanks. Thanks, Dr. Pankaj. I think that was very useful information, especially to the people who would want to join the course and who are attending the session today. So one thing is the people who are listening to this and who have some questions, you can put it on the chat so that I can route it to the right panelists here. So you can put your queries on the chat. So again, my next question again would be to Mr. Himanshu. So, sir, how does data science ICT role? I mean, basically, data science ICT. I mean, work in providing universal health coverage.
Okay, I think that's a very loaded term, universal health coverage, and it has a very wide connotation when it comes to uh, quality or healthcare, because healthcare as a nation we are progressing, as our conception of healthcare is also changing continuously. At one point in time, I think avoiding communicable disease was a good healthcare for us, but now that as we are moving to the non-communicable side of pattern, I think wellness is also now attributing itself into the healthcare domain. But to broadly highlight how ICT can help in this. I'll take a couple of example. Again, we'll go back to the COVID example, and I'd like to apprise the audience that Government of India is right now transforming the COVID platform to UVIN. UVIN is basically Universal Vaccine Intelligence Network, which will encompass all the vaccination which is done under the National Immunization Program. And this would be on the similar lines of COVID. So all the citizens or all the children who are born post 2024 will have all their immunization record intact. Unlike you and me, who have lost our immunization history, we have been vaccinated in the past either through pulse polio or any other vaccination, but we don't have the record to show it. And therefore, whenever somebody moves out of the country, they have to again vaccinate themselves. So that is one bit where the technology will be keeping a close track on the immunization cycle of the children's, because immunization, as I think many of you know, is the single biggest investment on which you get a very fairly high amount of returns when it comes to the healthcare. So one aspect is this under the UHC. The second is the Pradhan Mantri Jan Arogya Yojana, the PMJ, which in a colloquial terms is largely attributed to UHC being achieved in India, where if we are providing a decent amount of healthcare to the citizens of a country, then we assume that people in the country are assured of a basic minimum healthcare package delivery. So to share a little bit about PMJ here, while I think I briefly refer to the numbers, 550 million people across all the states and UTs, but the the layer below it, what the PMJ is doing right now is, I think, much mind-boggling per se, because so far under PMJ, since its inceptualization, that is until 2018, we have seen more than 6 crore hospitalization, which amounts to rupees of 80,000 crores. So that is straight away saving of 80,000 crore rupees of Indian citizens who belong to poor and vulnerable sections of society. Either they would not have availed any health services because they would not have the money, or they would have incurred it from their pocket. So that is also saving on the out-of-pocket expenditure. With both the contours in mind, we are still seeing a huge uptake in the PMJ insurance for a simple reason that the people in India either have unmet healthcare needs, or they are either were fulfilling it through PMJ. One of the biggest, I would say, beneficiaries again is women or the senior citizen of this approach in universal health coverage. Because if the family had to pay via their pocket, the women health would have been put at a second place. Now, with government assuring a 5 lakh health cover for the entire family, the women can also go and avail their health needs in a government hospital or in a private hospital. So this is again, in some sense, targeting the poor and vulnerable, and specifically women who face the challenges from both sides as well as the senior citizens. So the government is utilizing this entire IT platform of the National Health Protection Scheme, which is PMJ, to deliver the universal health coverage in the nation. Yeah, so that would be my brief response to this.
Sure. Thanks, Mr. Himanshu. I think it was pretty helpful, and it was loaded with information. So my next question would be to Mr. Shaurya. As someone who has worked across geographies globally, I mean, you have worked in US, you have worked in India, and quite some other countries. So, what are the current challenges in adopting AI?
Absolutely. Yeah, no, it's a very great question. And I'm going to touch on a piece that Mr. Manchu was talking about earlier. You know, the greatest challenge to driving AI adoption is the data. And I'll just give you a sense for the scope here. Over 35% of all of the world's data is generated in the process of delivering care in healthcare. And this is just the beginning as more digitization starts to permeate into the system. In the US, we see actually now that over 95% of health records are now digital. Thanks to the High Tech Act of 2009, you know, doctors have adopted it, and we're now seeing the benefits of that 15 years later. Now, the US has its own interoperability issues, which is a larger piece there because of the siloed system and the regulatory environment. And in India, we've kind of leapfrogged in that direction. We've created with the Ayushman Bharat Digital Health Mission, which I truly believe is one of the most, I think is the most innovative digital health infrastructure in the world. But creating a decentralized, health record system that's built on a blockchain, it's fundamentally revolutionary. And I actually moved to India because I believed in the vision of ABDM. But the fundamental barrier here to implementing AI is not ABDM, the interoperability. In India, it's the data itself. And specifically, as Mr. Himanshu mentioned, is the adoption of EHR. Unfortunately, in India, EHR adoption among doctors sits sub 10%. And I think that is the biggest lever that we can pull to really driving AI, to really driving digitization, is driving that visibility into patient demographics, into clinical data, into insurance claims. Because when we have that, we have the proof of the larger transition that's necessary to move towards value-based care, which everybody in the world wants to see. That the move towards preventative care, the move towards more consistent care. It only happens when you see the data that shows, okay, going to your doctor on a regular basis will prevent you ending up in a hospitalization. And that creates the evidence for outpatient coverage for insurance schemes, et cetera. But all of that starts with the claims data, with the EHR data. So I think that's, in my mind, the biggest thing that we as a government, as a country, can really push is how do we push the adoption of EHR? Because I think that's how we would really see the revolutionary change happen in India, because we have the infrastructure. We have the rails set up. Now we just have to make sure that the cars are being driven on the rails, right?
Thanks, Shaurya. So there is a question from one of the participants. So he wants to know, as a beginner who has just started working in ML and AI, what are some of the hot topics that he can work currently so as to get on board with the industry? Is there something which you can provide some information, Mr. Shaurya?
Yeah, absolutely. I mean, I think a couple of examples earlier, but what I would do is I would understand anything that you want to get interested in or anything that you want to work in. I would implore you to do what you're passionate about. Because if you're any space that you're passionate about, there is disruption happening in right now. So find what you're passionate about, find a space within healthcare. If it's in healthcare, that's great. If it's somewhere else, that's great as well. But find the space that you're passionate about, and then dig into your research as deep as you can to understand what is the technology that's disrupting that specific area. What is the technology that's changing that value chain? Because you can see it in every single part of the healthcare system. In diagnosis, you're seeing computer vision that it's improving the way and automating detection of, for example, there's SIGTUPL that's improving overall, automation of diagnosis. There's Curii that's working on TB computer vision. There's Neuromai that's working on breast cancer screening. There's Tricog that's working on cardiac screening. So that's just in the diagnosis space. And then you think about care delivery itself. There's 100 different use cases in the way that care is actually delivered. You know, for example, our Arman is this nonprofit that's providing they're built chatbots and an LLM that's for high risk pregnancy assistance. So, and they're really focusing on that last mile delivery. I personally have some friends that are using AI to build in. They're using machine learning models to develop better blood biopsies. So they're understanding biomarkers for cancer screening. Or, you know, there's ML models that a friend of mine is building that's for at-home monitoring for fall detection in the senior care space. So it's like, find a problem that you're passionate about solving. And I guarantee you there is an AI use case to help evolve that right now. But I think first and foremost has to be that passion on what problem you want to solve. And I guarantee you'll find an AI technology that you can use to solve it.
Thanks, Dr. Shaurya. I think that was really helpful. So there are quite some questions. So Dr. Pankaj, one of the questions is, what about the placement and package for this once the course is completed?
So, since the course has a greater industry linkage and moreover is equipping the student with the all futuristic industry trends, so I mean package may be as per the time, but it will be as per the at par with the industry at present. And moreover, it all depend upon the learner, how much effort they are putting along with us, along with the academia team, as well as the industry expert who are joining us for delivering their expertise. So both way it will be going on, and accordingly, I hope we are hoping the best, as we have a good team of academia. And moreover, we are having a very good team with the government experts are also providing their views, their suggestion well in time, and industry experts are also with us. So we hope a better future for the learners.
Thanks, Dr. Pankaj. So there's one question from Abhishek. I think Mr. Himanshu should be able to kind of give some information on this. So Abhishek wants to know with which education background is needed for admission. He would specifically want to know, is there any job opportunities, scopes in government sector? He wants to know on the job opportunities in the government sector.
I think the government is also looking for young professionals in each and every project which they are working, be it Ayushman Bharat Digital Mission, or be it PMJ, or be it National Health Mission. And government is constantly rolling out these opportunities in public domain, and people can look for these opportunities either on the website of the respective departments, or they can apply also through National Institute of Smart Governance, which is NISG, which is a source of human resources for all the respective government departments. So I think it's mostly just to keep an eye on the government websites where they do roll out such vacancies. Even young professionals is something which is a very I would say a hot position, which the ministries are regularly putting it in the public domain. So I think again, I would again go back to what Shaurya said, that it's about your individual's passion. If you want to really want to, because again, challenges in the government sector will be different than what the challenges are in the private sector. So it has to be really driven by one's motivation, that what do you want to work and learn within the government sector, and then accordingly join that particular mission or a project.
Thank you, Mr. Himanshu. So maybe this will be the last question. There are quite some other questions. So I would request that the people who have posed these questions reach out to Joyce or Dr. Pankaj. We'll be giving those details after this in a link. So they'll basically help you with these questions. So one final question, Dr. Pankaj, is this course helpful for healthcare management students? And what is the basic qualification required?
So the course is fully beneficial to healthcare management students also, and the basic qualification required is the medical or the allied health degree, and with the +2 with the mathematics, statics, or computer science as one of the subject for this new course. Initially, because all the computational techniques are going to be learned, or going to be teach during the course. So that is the minimum requirement, so that student will not feel that he is not understanding that much, which is he is looking forward. So that is basically we have put up. Other than that, I mean, the institution is taking further from the beginning all technology from basic to the expert level we are teaching here. So whatever is the course curriculum, we are teaching from the basics to the expert level, along with the industry and other government project exposure. We are teaching the students.
Thanks. Thanks, Dr. Pankaj. I think it was really informative. And also, we have reached the end of the session timings. So, for me, also personally, I think it was quite informative. There were few things which I didn't know, which even I kind of learned over the session today. So, one thing which I understand is that instead of feeling threatened about AI and data science, so it's time we embrace it and go with it. Because that will empower us rather than worrying about job loss or anything of that sort. So if we embrace it, learn it, it will help us in making life better for us and better career prospects. So thanks for this great session. So one of the things to the all the other participants is there's a series three which will be coming up. It will be coming up sometime in June. So watch out for the space. And again, for questions, please reach out to Joyce or Dr. Pankaj. And also there is a link which is provided here in this chat box from IHMR Bangalore. So please fill it out. So based on that, you will be getting the participation certificates. So before we end, I request all of you to come on camera because we can take a picture of it to post on our site. So if all of you can unmute your cameras, I mean, basically enable your cameras, it will be helpful. So I think the photos have been taken. Can you confirm the IT team?
Yeah.
Okay. Thanks all. And special thanks to Mr. Himanshu, Mr. Shaurya, Dr. Pankaj.
Thank you.
Very informative session from all of you. I mean, great. It was great talking to all of you.
Really enjoyed it. Thank you, Mr.
Thank you.
Mukund.
Thank you.
Thanks, Dr. Pankaj. Thanks, Mr.
Yeah,
Mukund.
thank you all.
Thank you.